As they reviewed this footage, they would find something truly chilling going on in that hallway that totally explained all of the sudden cardiac arrests that had been happening inside the SurgiCare Center. An anesthesiologist named Dr. Chad Marsden stood inside of an operating room with a nurse, a surgeon, and their unconscious patient. Dr. Marsden worked at the Baylor Scott & White SurgiCare Center in Dallas, Texas, and it was his job to make sure patients stayed asleep during surgery and then woke up safely afterward. That day, Dr. Marsden and his colleagues were wrapping up a routine liposuction procedure on a middle-aged woman. And so Dr. Marsden turned off the anesthesia machine, and then Dr. Marsden removed the breathing mask. Then he changed her IV from an anesthetic mixture to regular saline. After that, they pushed her out of the OR into the hallway down towards the recovery room. But as they were walking down this hallway, Marsden happened to look down at their patient, and immediately he knew something was wrong. This woman's skin had turned completely gray. He looked at her vital sign monitor and saw that her blood pressure, which just moments ago had been normal, was now dangerously high. And then as he's staring at her monitor, her blood pressure plummeted. And then also her oxygen levels fell, and then she began foaming at the mouth. It was clear this woman was going into cardiac arrest, which meant if they didn't act quickly, her heart was going to stop. He began giving the woman chest compressions. Meanwhile, the surgeon administered oxygen and blood pressure medication, and the nurse called for an ambulance. The reason she had to call for an ambulance is because the SurgiCare Center was not equipped to handle medical emergencies. And then just a minute later, 2 paramedics came running down the hallway. They put her in the back of the ambulance, and they sped off to the local hospital. This type of emergency, somebody going into unexplained sudden cardiac arrest following a totally routine surgery, was extremely rare. But for Dr. Marsden, this was not the first time he had seen this. In fact, literally the day before, a different patient had also gone into sudden, unexplained cardiac arrest following their routine procedure. The SurgiCare Center's administrator was a woman named Ashley Burks, and when she heard about this second unexplained cardiac arrest, she knew she had to call a staff meeting. Ashley began by updating everyone on the 2 patients who had been rushed off to the hospital, and she said they had stabilized and they'd be okay. But Ashley then said what everybody in the room was thinking, which is, sudden, unexplained cardiac arrest is so rare, we can't just treat these things like coincidence. The first thing she did was she looked at the 2 patients' files to see if they had specific allergies or medical risk factors that might have been overlooked by staff. But when she looked at their files, neither patient had those risk factors or allergies. They were in different operating rooms, going through different procedures with different medical teams. So Ashley said to the group, perhaps the equipment in the SurgiCare Center had malfunctioned. And so what she was going to do was just begin testing all of the equipment in the building. 3 weeks later, Ashley stood outside the OR in the hallway, looking through a cabinet that contained surgical. She'd printed out a list of recent recalls and was now comparing that list against all of the inside of this cabinet. There was nothing in their cabinet that was on the recall list. Ashley shut the cabinet and walked down the hallway towards the break room to grab her lunch. But the moment she walked inside, she saw a group of her colleagues sitting around a table looking very upset. In fact, some people were visibly crying. And so Ashley walked up to them and said, "Hey, what's going on?" And a nurse told her that one of their colleagues, an anesthesiologist named Dr. Melanie Kaspar, was dead. Apparently, the night before, she had had a heart attack at her home, and her husband had found her and called 911, but unfortunately, by the time paramedics arrived, she was already deceased. Ashley was shocked. She knew she was in great shape. She was only in her mid-50s. I mean, she did not seem like someone who might just randomly have a heart attack. 5 days later, Ashley was sitting in front of her office computer ordering supplies for Dr. Kaspar's memorial when suddenly she heard these loud, fast footsteps out in the hall. And then a moment later, Ashley saw her door burst open and the anesthesiologist, Dr. Chad Marsden, was standing there, and he looked absolutely horrified, and he just said to her, "It's happening again." Ashley's stomach dropped, and she jumped up and sprinted after Dr. Marsden. And when they got there, Ashley immediately heard the sound of that long single beep of somebody's heart monitor flatlining, and she looked over and she saw a surgeon performing chest compressions on an elderly patient. Ashley could tell this man was unconscious, his skin was gray, and he was foaming at the mouth. It was exactly like the other cardiac emergencies that had happened before, except this time was worse, because that beep, that flatlining beep, meant that this man's heart had actually stopped. And so Ashley just stood there in horror, watching the surgeon perform these chest compressions, knowing that if that didn't work, he was about to die. Just then, Ashley heard the sound of the doors leading into the OR hallway open, and these two paramedics came rushing inside, and right as they passed her and got to the doorway leading into where this man was basically dying, Ashley heard the sound of the flatline beep turn into regular beeping, which meant the surgeon who was doing chest compressions had managed to restart this man's heart. And so once they were gone, they all just looked at each other like, what is going on here? Clearly, there is something causing all these sudden cardiac arrests, but still nobody knew what it was. Ashley was determined to find out. Over the next 2 months, Ashley interviewed and observed every single employee of the surge care center to make sure they really were following their protocol absolutely to a T. They were doing exactly what they were supposed to be doing. And yet, the cardiac emergencies kept on happening at the surge care center. There were 3 incidents in July and 4 more incidents in the first 3 weeks of August. And so in total, that made 10 patients at the surge care center who had all gone into sudden unexplained cardiac arrest. Now, none of them had died, but Ashley knew a few of them had been left with permanent heart damage. And so she was feeling completely overwhelmed and desperate until August 24th, when 2 things happened in quick succession. First, in the morning of August 24th, Ashley received a phone call from an officer at the Dallas Police Department, and they told her that the autopsy had been completed on Dr. Melanie Kaspar. And this police officer thought that Ashley really needed to know that her heart attack had not been natural. It was actually caused by an of a called bupivacaine. It was a that was basically only used in surgical anesthesia. But Ashley had never heard of anybody abusing this or on it, because bupivacaine does not make you high. But regardless, he thought Ashley should know because he thought it was possible that Dr. Kaspar had gotten the bupivacaine from the surge care center. And then Ashley walked to the OR hallway to check the cabinet where drugs like bupivacaine were stored. But as soon as she entered that hallway, the second thing happened that day. Ashley heard chaos break out inside of an operating room where she knew an 18-year-old boy was undergoing what should have been a routine sinus surgery. And so she watched helplessly as the doors flung open and a nurse came running out into the hall to call an ambulance. And then inside the room, Ashley saw an anesthesiologist performing chest compressions on this boy, and another doctor was administering oxygen and blood pressure medication. It was the same nightmare playing out now for an 11th time. But this time, after the EMTs wheeled this boy away to be driven off to the local hospital, Ashley was so desperate to figure out what was going on here that she just couldn't wait. And so she rounded up a couple of hospital staffers that were nearby, and they went into that operating room and they checked the medical equipment, they checked the that had been used, they searched the floor for anything that might have had something to do with this. I mean, they even searched the trash can. And in the trash, Ashley found something that the second she saw it, it made her blood run cold. She couldn't believe somebody would do something this awful, or why they would do this. And so she took the thing she found in the trash and she ran out of the operating room and upstairs to call the police. Minutes later, 2 police officers arrived at the surge care center. When they looked at it, they knew they had a very serious situation on their hands. And so right away, they roped off the operating room where this 18-year-old boy had been, and they began looking for evidence inside of there. And then also, they began reviewing the security camera footage from the OR hallway. And as they reviewed this footage, they would find something truly chilling going on in that hallway that totally explained all of the sudden cardiac arrests that had been happening inside the surge care center. A hospital employee is seen walking down the OR hallway carrying a stack of papers under his arm. He walks past a couple of his colleagues and he arrives in front of this big metallic device that sort of looks like a refrigerator, and he opens it up and he reaches inside and he pulls out a saline IV bag. That metal device was a warming machine where saline IV bags were stored to be used during or after surgeries. But the police watched this footage over and over again, and they saw this employee who walks up to the warmer was not just carrying a stack of papers. He was also hiding something within those papers, his own saline IV bag. And so before this man takes out an IV bag from the warmer, he takes this hidden one and places it in the warmer as well. So he's basically swapped one for one. And this was absolutely bizarre because it was not his job to be restocking the warmer. And so about 30 minutes after this employee has placed his own IV bag inside of the warmer, a nurse comes out of the OR, walks down the hallway, opens up the warmer, takes one of the warmed up IV bags, carries it down the hall, goes back into the OR, and minutes later, her patient goes into cardiac arrest. It would turn out that nurse had inadvertently grabbed the saline bag that the male employee had secretly placed just minutes before. And she didn't know that that saline bag is what caused the cardiac arrest until days later, when Ashley is so desperate to figure out why all these patients are going into cardiac arrest that she began searching through the trash, and she would find an empty IV bag, and she would see very clearly there was a little puncture on it. And inside, they found a combination of 3 that, when combined, are like a biological bomb that will send somebody into cardiac arrest within minutes. They were lidocaine, which is an anesthetic, epinephrine, which is basically pure adrenaline, and crucially, the third found was bupivacaine, the anesthetic that Dr. Melanie Kaspar had on, which caused her to die of a heart attack. And this discovery meant that Dr. Kaspar's death was almost certainly connected to these poisoned IV bags. On the day of her death, she was feeling so unwell at work, she had taken a saline IV bag from that warmer and brought it home with her to rehydrate herself. The one that she grabbed was one of the poisoned ones. The man who was doing the tampering was Dr. Reynaldo Ortiz. Dr. Ortiz had allowed one of his patients to stop breathing, nearly killing the patient. And so as a result of that incident, Dr. Ortiz had been placed under internal investigation by the Surgicare Center, and he was facing the possibility of losing his medical license because of negligence. Dr. Ortiz decided he would just try to make all the other doctors look negligent too, taking the attention off of himself. And so he began sabotaging his colleagues' surgeries by injecting those into their patients' IV bags, knowing it would cause cardiac arrest. Now, none of the patients who went into cardiac arrest at the Surgicare Center died. However, Dr. Kaspar, who took that tampered IV bag home with her, did die. And so ultimately, Dr. Ortiz was responsible for her death. In April of 2024, Dr. Ortiz was found guilty on multiple charges, and he is currently facing a sentence of up to 190 years in prison.